Hi everyone, Dr. Nemechek here. I want to discuss the data that's suggesting that COVID is, one, causing greater deaths in people with prior cancer, and two, might actually be triggering secondary disseminated cancers. Okay, so we've got this basic graphic here. You get infected, red is symptoms, which again is only maybe a third to half the cases, but whether or not you have symptoms or not, you're going to get this inflammatory phase that will resolve. Okay, that's what we hope happens in people, because that has the least amount of risk of developing kind of long COVID or other complications. And because in long COVID, what we get is this, again, infection, virus shedding, symptoms start. Now, you may not have symptoms, okay, and you can still get this, but the blue line is the inflammation. Now, in long COVID, this is the dangerous part, where you have this chronic, unforgiving, chronic inflammatory process, and we're worrying that this is contributing to a recurrence of cancer in patients. Now, when people have cancer, say breast cancer, and many forms of cancer, we know by the time the cancer is diagnosed and treated, even if it's in a very early stage, that oftentimes you can actually detect cancer stem cells in the bloodstream. And these are going to kind of land in the tissue and stay there. And often you'll get them landing in the lung, okay, like here, dormant, disseminated cancer cells. When you don't have any inflammation, when the body's functioning normally, your immune system will control these, and more than likely you will never have cancer again, even though you technically have some cancer cells. And it's because you have this low inflammatory environment, and which inhibits cancer kind of growth and aggression, and the immune system is functioning well to kind of just seal these off and protect you from them, okay? But now when you get a respiratory infection, that's IL-6 in particular, it's one of the inflammatory cytokines, these dormant cancer cells become active. And now you'll get clusters of cells growing in your lungs, okay? And that's kind of what's happening after viral infections. Now, let's look at the bottom part first. So, 7 viruses involved in cancer development. We know this occurs with Epstein-Barr, hepatitis B and C, HPV, right, that causes cervical cancer or head and neck cancer, HCOV1, HHVA, these cause Kaposi sarcoma, and Merkel cell polyomavirus. So these are known infections that can stimulate and trigger the development of cancer, okay? Now, when we're looking at adults who get COVID, if you've recently had cancer, the mortality rate is pretty high. Okay, recently is typically within a year. So, and that we believe is related to the inflammation. Okay. Now, that drops a little bit of people who've had cancer, but not recently. So that number is, we typically, let's say, after 5 years, as compared to people without a history of cancer. So cancer really greatly increases your risk of mortality with COVID, okay? And the belief is it's related to this surge of the viral particles and the surge of the inflammation, both of which the vaccine, they don't stop, but they lower it greatly, as well as, so does like treatment with Paxlovid, so that's the antibiotic for COVID. And if you take it within the first couple days, it dramatically prevents that from occurring, or blunts it, I should say. And we look at some more data here. If you just look at people who show up with metastasis of cancer to the lung, you're like, what is the factor here? So one is average, everybody. And when you look at the biggest outlying factor is they've had COVID in the past. They're much, much more likely to have a metastatic cancer in the lung than people without COVID. All right? And here's another way to look at it. Here's mortality in cancer patients who have COVID infection. And you can see this is compared to non-cancer. This is non-cancer patients. So when you compare them, look at here, you're about 6, almost 7 times, that's these numbers over here, 6 or 7 times more likely to die if you've had a history of cancer. And then if you break that down, it's in terms of non-COVID, meaning non-respiratory or no blood clots or something, you're still 3.5 times. And if you look at specifically, do you die of cancer? Again, and here, this is people who had cancer 5 or more than 5 and more than 10 years ago. You're still 2.5 times more likely to die of cancer again. All right? And what's happening there is these stem cells are becoming activated, even 5-10 years later. Okay? Now, we don't have the studies yet that proves vaccine or Paxlovid will reduce cancer. But we do have studies that show that getting the vaccine or using Paxlovid in the first couple days of your illness significantly lowers the inflammation that can trigger long COVID, say in neurological problems. And it's that same inflammation we think that is involved in this awakening of these, primarily quiescent cancer cells. So, and I know a lot of people have a lot of thoughts about vaccines in general and Paxlovid, and I'm not trying to convince you of anything. But if you have a history of cancer or you have a loved one that has a history of cancer, you just might consider that the vaccine and the medicines may prevent their cancer from returning. Okay? The odds are pretty high, right? The odds are pretty high. Okay? Death after COVID, patients without cancer, 1.6%. Almost 8% die if it's recent. That's a huge difference. So anyhow, hope that helps everybody to think about these vaccines and treatments in a little different way than just, oh, my respiratory symptoms, I'm fine. All right? Okay, everybody have a good day. Take care. Bye.